Nice. Good. Good.
Oh.
Nice.
That was loud.
Nice. Hey guys, Dr. Will here from Miami Spine and Performance. Today I'm here with Eric, one of my patients. Eric is an engineer, so he spends a lot of time throughout the week sitting at the computer, at his desk, working intensely. So obviously that can lead to some postural issues in the upper back, some tightness in the hip flexors. In addition to that, Eric is an avid Jiu-Jitsu practitioner. So for those of you that know Jiu-Jitsu, it can be very, very hard on the body. So a lot of times with Eric, what we're focused on is making sure that, all the time at the desk doesn't set him up for injury when he goes to the Jiu-Jitsu gym, and his hips and his spine are put in all sorts of different positions. So today Eric's dealing with a little bit of a hip flexor issue. So what we're going to do is we're going to take Eric through a full body adjustment, show you guys how that looks. And then we're going to show you how we use some other tools, active release technique and shockwave, to work on his hip. So first thing I'm going to have you do, Eric, is lie face up for me, please. So the first area that I'm always looking at generally on people when I'm adjusting them is going to be their thoracic spine. This is the middle part of your back, in between your shoulder blades, tends to get really, really locked up when you're working at the computer for long periods of time. Scoot towards me just a little bit. Let's have you cross your arms. Eric's a pretty big guy, so we have to use a little bit of leverage here. Good. I'll get one spot a little bit higher here.
Oh.
Nice.
Yeah, that worked.
Now I'm going to have you lay on your right side for me. So that adjustment really makes sure that Eric can get upright and utilize thoracic extension, and he doesn't get stuck in this position. Now we're going to check out his lower back here, SI joint. He's a little locked up in his SI joint on the left side. Give it a little pull. Take a big breath in for me. Breathe out. Good. Other side.
Oh, man.
Here. So Eric can vouch for, if you're someone who does jiu-jitsu regularly, adjustments are pretty helpful, wouldn't you say?
Yeah, they're mandatory.
Big breath in. Breathe out. Good. Face up.
Yeah. Oh.
Right. So when I first started working with Eric, we were spending a lot of time on his neck. Fortunately, through getting adjusted regularly and also helping Eric with some of his exercise programming, he hasn't had as much neck issues with jiu-jitsu, but I think adjustments really helped him a lot when he was dealing with neck issues. That's probably the most common thing that I see with my jiu-jitsu guys and gals is neck problems. Have a little fixation here at C3.
Oh.
Nice.
That was loud.
Lights just got a little brighter.
A little bit. I got a little lighter.
Nice. All right, last but not least, we're going to check the feet. So sometimes people don't realize that chiropractors, we also adjust shoulders, knees, wrists, and feet. Eric has a little bit of an issue with or a history of ankle issues. So we're always checking his ankles and midfoot to make sure everything's moving well. A little here. So by adjusting the midfoot, we can make sure that when he walks and runs, he's getting good extension of the foot here, right? If this gets locked up, you end up with this kind of heavy gait pattern that can lead to some jamming up of the hip. There we go. And the right one. Oh, good. A lot of movement in there.
Mm-hmm.
This is the post-surgery ankle, so there's a lot of scar tissue in here, so it tends to lead to the foot getting really, really tight and stiff. Eric, you're dealing with some right-sided
Hip flexors.
hip flexor. Okay.
And a little of the hernia still too.
Okay. So let's have you lay on your left side. We're gonna go right into some active release technique. As you guys know, if you follow me on Instagram or you follow my YouTube channel, or if you're a patient, ART is really my kind of soft tissue technique of choice. It allows for muscles to slide on one another, so it allows for better joint range of motion and allows you to access strength in that joint better. So I'm going to come in and contact the psoas. This is typically the muscle that's problematic. I'm going to have you bring your knee to your chest slowly. There we go. And now extend back behind you slowly. Exhale. Good. And Eric can feel that muscle kind of lengthen under my hand. Good. Bring it back up. And again, extend. Exhale. And again, one more. So we're kind of working different aspects of the psoas and the iliacus. Good, extend. There, that's it. Let's do one more on that spot. Here we're on the upper part of the iliacus. You can feel there's a trigger point right there. Go for it. Straight out. Good. And relax. So for me, working on the psoas iliacus and ART that way is my number one kind of lower body soft tissue technique. If there's only one thing that I could do to someone's hips, it would be release the psoas. The psoas is going to pull you into this anterior pelvic tilt. It's going to make you feel tight in the front of your hip and kind of mess with the mechanics of all your hip motion. Now what we're going to do is we're going to work on the upper glute max. Okay, so we're going to work the other end of the joint. So Eric's going to be swinging his leg in front of him. Good. Exhale. And come back. Keep that top leg straight for me, Eric.
Okay.
And then go straight out in front of you. Drop down.
Oh.
Yep. Exhale. Turn your torso up to the ceiling. Exhale. Good. All the way back. And one more time. Exhale. Let your knee relax onto the table. Exhale. Good. Back on your side. That a little bit sore in there?
Yeah, a little bit.
Let's go here. So now we're going to find the TFL. So if you're somebody that has tight IT bands, TFL is usually the culprit. IT band being the side of your quad. I know a lot of you that squat and lift weights, you feel like your IT bands are super tight. They're tender with foam rolling. What a lot of people don't realize is usually IT band tightness is because of this muscle up here called the TFL. Okay? Don't mind Eric here. He's used to it by now.
Uh-huh.
Okay, Eric, so you're going to straighten out your leg, bring it behind you, and relax it down to the floor. We're just going to kind of peel the TFL off of the iliac crest there. Okay, come out and back. Let the leg relax. Sink into my contact. Bring it back. Exhale. Let it totally go. So as he relaxes the muscle, I'm going to find a little more depth in there. Good, one more time. Bring it back. Exhale. I'm going to let him move, take some pressure off, and now add some pressure in. Exhale. One more breath. Relax the leg. Good. Nice. Okay, so that's typically an abbreviated ART session to really kind of open up the whole hip complex. You'll notice I worked all three sides of the joint, right? Even though he's feeling pinching in the front, we want to make sure the whole joint is open because it is a ball and socket joint. Now I'm going to show you guys how I utilize the Shockwave machine to help with this issue. So patients are often asking me, what does the Shockwave do differently from the massage gun? Or they'll say, oh, I have a Shockwave machine at home. Well, they're usually referring to a TENS unit. Okay, so what a TENS unit does, that's when you have those electric patches. And what that's going to do is that's primarily for pain relief, right? It's kind of the equivalent of like rubbing your elbow after you bump it. It's just going to give your nervous system something else to focus on so that the muscle can relax. Same thing with the massage gun. It's really all neurological feedback. The Shockwave machine actually goes in and it targets scar tissue. So it uses acoustic waves to interact with scar tissue, break down the scar tissue, and allow the body to re-heal with healthy muscle tissue. So if you have a chronic hip injury or you've been sitting for 20 years because you've been working at a desk, the Shockwave is a great adjunct to get in there and break up some of the chronic issues that you have going on. Okay? So we're going to target this right hip with the towel here. So in Eric's case, we're going to really focus on the side of the hip and the TFL. Often asking patients for feedback, finding those tender points, because those are going to tell us exactly where the scar tissue is. I'm going to apply some ultrasound gel. And we're going to get right in there. Go, Matt, more a little bit.
Oh, yeah.
So if Eric feels a little sensitivity, we're just going to keep some constant pressure on there with some small circles. Again, right now we're on the back side of the hip flexor, the front of the TFL, and then we're going to also back up and get into the glute medius as well, kind of following up that iliac crest. So again, this is one of the tools I think is most effective of all the things I do at this office, which is the Shockwave therapy. Ever since I started integrating this about a year ago, the amount of soft tissue injuries that I've been able to fix that are really, really chronic has been amazing. I always had really good tools for, a hamstring strain or tennis elbow, but now when people come in and they're like, Doc, I've had this issue for many, many years. I haven't had any success. Shockwave a lot of times tends to be the thing that kind of pushes it over the edge. So again, I'm going to make small circles here. I use a Chattanooga Shockwave machine. I've had a great experience with them so far. Their mobile RPW unit. Good. And typically patients, as we go through treatment, they'll feel a little bit less sensitive. Is it feeling a little bit less sensitive, Eric, than when we started? Yeah. So as your body kind of gets acclimated to it, as it starts to affect the tissue, you're going to feel less and less sensitivity. And so we use it as an audit. So as we go through, we're going to consistently recheck the area with the Shockwave until the patient has no discomfort. So whether it be 3 sessions later, 5 sessions later, when the patient's not feeling any type of discomfort with the Shockwave machine, that tells us that the scar tissue is healed. So there you have it, guys. That's a typical session for a jiu-jitsu athlete, hardworking engineer. What we do during his kind of tune-up sessions, Eric comes in typically like twice a month. We do adjustments, we do soft tissue work. Sometimes we also incorporate things like cupping or compression boots as needed. But when Eric comes in with an injury or any other athlete comes in, that's typically the treatment approach. So thank you guys for watching. Don't forget to like, comment, and subscribe.